Hi, it's Dr. Pat with Little Critters, and we have Louie here today. She's a 25-year-old African Gray, and she's in because she's having some weakness in this left leg. Louie's a little angry about being at the doctor today. Louie, this way, this way, good girl. So if you watch Louie walk, you'll see that this left leg is held out to the side. And when she perches and she moves, she's not fully extending her tarsus. She keeps it flexed. And there does seem to be a little sensitivity on the tarsus when we try to move it. A little difficult to assess because she talks to us through everything she does. But there are a few concerns with that. So when we have a bird, one of the reports from the owner was that she's not gripping her perches normally and she's falling. And when we have that signalment and history from the owner, some of the concerns are neurologic problems, so we can get viruses that can cause balance problems and neurologic disease in parrots. And other concerns, particularly in African Greys, we worry about low calcium levels. The typical scenario with an African Grey that has lower calcium is a toe twitch, where they'll sit on their perch and twitch their foot or tap their foot, or tremors. So this doesn't fit that as closely as we would think. African Greys also get a lot of heart disease or atherosclerosis, so clotting in their arteries of their heart, and it can cause weakness or syncope, and sometimes they'll fall off their perch. They can actually faint. And then trauma is a factor, and also arthritis. One of the things we're concerned about in Louie, who's sitting here like a good girl but a little angry girl, is that she has a very loose fitting band. Louie, be good girl. Good job. A very loose fitting band on the affected leg. And the concern with these bands is oftentimes things get wedged in them, and then it will torque their leg and injure their leg. And so we're concerned that she may have had an injury at one point that wasn't identified. And that can result in trauma to the leg, and potentially months or even years after the fact, we may be dealing with arthritis in that joint. At 25, she could have arthritis as well, just a primary onset. Although it's not as common, we can see it, and certainly in our older birds we see arthritis frequently. So we're getting, and if you look at Louie's chest on the bottom here, I don't know if you can see it when she raises her head up. She is doing, unfortunately, something the many African Greys do. She's feather picking, and she's picked the feathers on her chest, and she actually has chewed her skin and has a wound to the left side of her keel on her chest. So she has feather destructive behavior and skin mutilation. This is very common in African Greys. It's often secondary to other issues, so social maladaptation, where they're not adjusting readily to change or stressors in the environment. That's frequently in baby birds that were not raised in a very social setting. In the old days, you think of them as the butter bowl birds. They were placed in isolated containers and raised rather than a group with other birds who learn to interact with each other and interact with the environment and not be afraid of everything. Reproductive issues will also cause them to feather pick, and that's very common. And pain and stressors from anything else, potentially including the leg, could be causing her to act out and feather pick. And then malnutrition could be a factor in this as well. So with Louie, we're doing some blood work. We're checking metabolically what's going on. We're looking at her calcium levels, and we are getting some x-rays of both her heart and body cavity as well as her limb. And then we are putting her on an anti-inflammatory for pain and inflammation, and trying to address the immediate concern while we get our results. So that's Louie, the Congo African Grey.